So I am going to check my patient's order sheet, gather my supplies, enter the patient room, and close the door behind me for privacy. Hi, my name is Taylor Davenport. I'm going to be your nursing student today, taking care of you. Can you confirm your name and date of birth for me?
Samantha Husses, March 30th, 1998.
All right, Miss Samantha. Do you go by Samantha, or would you rather me call you something else?
You can call me Sammy.
Okay, Miss Sammy. We're going to be doing a couple different assessments on you today. I'll explain those to you as we go along, okay? So I'm going to wash my hands and go ahead and raise your bed up to the appropriate height. So, just from here and across the room, I can tell that my patient appears to be 22 years old. You can go ahead and remove your mask for me. She is well dressed for the weather, well nourished, well groomed, appropriate hygiene, appropriate mood and affect for the situation. Her facial expression is pleasant. No involuntary tics or movements. I don't know any facial distress or nasal flaring at this time. So, Miss Samantha, I'm going to ask you a couple silly questions. What would you do if this building was on fire?
I'd run out.
Okay, and where are we at right now?
Semi.
And what are we doing today?
Health Supplement.
What year is it?
2022.
And go ahead and tell me your name again.
Samantha Husses.
Awesome. So my patient's judgment is intact, and she is alert and oriented times 4. She responds to verbal stimuli. I'm going to give you 4 words. I'm going to have you repeat those 4 words back to me after a couple of questions, okay? Your 4 words are money, tree, cookie, and sock.
Money, tree, cookie, and sock.
Okay. What did you eat for breakfast yesterday?
Yogurt and granola.
And what year were you born?
1998.
And give me those 4 words back.
Money, tree, cookie, and sock.
Awesome. So my patient's immediate, recent, and remote memory are all intact. Her attention span is intact, not easily distracted. Cognitive ability is also intact. Her speech is clear and coherent and at an appropriate rate. So Miss Sammy, I'm going to go ahead and get a baseline set of vitals on you. I'm going to get a blood pressure, a heart rate, a temperature, a respiratory rate, SpO2, and a pain scale. Are you in any pain right now?
Nope.
Awesome. So we're going to start with your cardiac and respiratory assessment. Just kidding. I'm going to do your cranial nerves first. So I'm going to have you close your eyes and include one nostril for me. And tell me when you smell this and what you smell.
Not alcohol.
Awesome. That is intact bilaterally. I'm going to check your optic nerve, cranial nerve number 2 next. So I'm going to have you close one eye for me and look straight at me. Tell me how many fingers I'm holding up.
3.
Awesome. Intact bilaterally. I'm going to check cranial nerve number 3, oculomotor next. So I'm going to shine a bright light in your eyes, okay? Just look straight ahead. And look at my pen. Follow it in. Pupils are equal, round, and reactive to light and accommodation. I'm also going to check your 6 cardinal gazes, which takes care of cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens. So look straight at me and follow this pen with your eyes. And 6 cardinal gazes are intact. No nystagmus noted. I'm going to go ahead and check trigeminal, which is cranial nerve number 5. Go ahead and clench your jaw for me. Any tenderness there?
No.
Go ahead and open your jaw. And no crepitus is noted. Cranial nerve number 7, facial nerve. Go ahead and smile for me. Frown. Raise your eyebrows. And show me your teeth. Facial nerve is intact bilaterally. I'm going to go ahead and step behind you. I want you to occlude one ear for me. This is for cranial nerve number 8, acoustic. Go ahead and repeat these words to me.
1, 2, 3.
Awesome. Intact bilaterally. Cranial nerves 9 and 10. Glossopharyngeal and vagus. Can I have you open your mouth and say ah? Uvula and soft palate rose. Uvula is midline. Spinal accessory 11. Raise your shoulders up for me. I'm going to depress. Okay. Intact bilaterally. Cranial nerve number 12. Hypoglossal. Stick your tongue straight out. Move it side to side. And say light type dynamite.
Like tight dynamite.
Awesome. Now we're going to move on to your cardiac and respiratory assessment. So, just from here I can see that my patient is not using any accessory muscles to breathe. No intercostal retractions. Chest is symmetric. Equal chest to rise and fall bilaterally. No masses, lesions, scarring noted. My patient's spine ears aligned. I'm going to go ahead and check your AP diameter. 2 to 1. So for the lung fields, there are 3 lobes on our right lung, 5 lobes total. 3 lobes on our right lung, upper, middle, lower. 2 lobes on our left, superior and inferior because of the placement of the heart. The heart, the right side of the heart is anterior, the left side of the heart is posterior. The base is at the right sternal border, the apex is at the 5th intercostal space mid-clavicular line. So I'm going to go ahead and auscultate for my cardiac assessment. We're listening to the aortic, which is at the 2nd intercostal right sternal border. Pulmonic, 2nd intercostal left sternal border. Irv's point, 3rd intercostal left sternal border. Tricuspid, 4th intercostal left sternal border. Mitral, 5th intercostal mid-clavicular line, left side. We're listening for S1 and S2. S1 is the AV valves closing. S2 is the semilunar valves closing. I'm going to go ahead and auscultate for breath sounds as well while I'm anteriorly. So I'm going to listen to 5 places bilaterally. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5. I'm going to go ahead and move around posteriorly. I don't know if you can see me. Okay. Posteriorly, I'm going to auscultate 9 bilaterally. 1, 2, 3, 4, 5, 6, 7, 8, 9. And I hear clear breath sounds anteriorly and posteriorly. No adventitious breath sounds, no wheezing, no crackles, no rails, no rhonchi. I'm going to go ahead and percuss in 9 places bilaterally. 9. I should hear resonance throughout dullness over our fluid-filled organs and flat over our bones, such as the scapula. Go ahead and say the words 99 for me.
99, 99, 99, 99, 99.
Okay, you can stop. Tactile firmament is intact bilaterally. Go ahead and take a deep breath in for me. And back out. Chest expansion is equal bilaterally. I'm going to go ahead and check your costovertebral angle along back here. Tell me if there's any tenderness.
No tenderness.
Bilaterally.
No tenderness.
Awesome. So, I'm going to go ahead and do your hair and facial assessment now. So, hair is evenly distributed, moderately thick, smooth texture. There's no vermin, lesions, or scales. No excessive oiliness or dryness, appropriate lubrication. I'm going to go ahead and palpate your frontal and maxillary sinuses. Tell me if there's any tenderness here.
No tenderness.
Here.
No tenderness.
I'm going to also palpate your lacrimal apparatus. Tell me if there's any tenderness.
No tenderness.
Awesome. So your eyebrows, eyelids, and sockets are all symmetric bilaterally. Go ahead and pull down for me. Conjunctiva are pink, sclera are white. Nose is symmetric, shape is appropriate for face structure. Mucous membranes are pink and moist. Tell me if there's any tenderness.
No tenderness.
No tenderness on the auricles bilaterally. I can see into the ear canal bilaterally. There's no drainage noted. Lips are pink and moist. Go ahead and say ah for me. Mucosa, gingiva, pink and moist. Pharynx is intact. Dentation is intact. My vision is tired. I'm going to check your lymph nodes now. So, preauricular, postauricular, occipital, posterior cervical, deep cervical, superficial cervical, jugular digastric, submandibular, submental, supraclavicular. I'm going to stand behind you. Swallow for me. Trachea is midline, thyroid is not palpable, trachea is easily displaced. Neck is supple, no rigidity noted. I'm going to go ahead and check your pulses, okay? So, carotid, brachial, radial, femoral, popliteal, dorsalis pedis, posterior tibialis. There's no signs of edema. Those are all 2+ bilaterally. I'm going to check your skin while we're here. Go ahead and pull your sleeve up for me. Alright, Skin is warm to the touch, texture is smooth, no excessive dryness, no diaphoresis, no scars, lesions, masses noted. Turgor is returning within 2 to 3 seconds. Cap refill is less than 2 seconds. Nails are slightly curved in shape. Nails are translucent. Nail beds are pink. No signs of cyanosis. No excessive thinning or brittleness. Go ahead and make a club shape for it, or a diamond shape. And there's no signs of clubbing noted. That's the results I'm looking for. Okay. I'm going to have you close your eyes for me. Tell me if this is sharp or dull.
Sharp.
And dull. Awesome. Tell me if I'm going up or down on your skin.
Down.
And
Up.
okay. Are you having any pain right now?
Nope.
Your color is appropriate for race and ethnicity. We've already checked your pulses. Are you having any numbness or tingling anywhere?
Nope.
No paresthesis. Are you having any trouble moving any of your extremities?
No.
And no paralysis is noted. So I'm going to check your reflexes while you're sitting here. So patellar first. There we go. And plantar.
That's such a question.
I'm going to stop laughing. Deep tendon reflexes are 2 flexed bilaterally. A negative Babinski's toes curl under for adults. Okay, so that just cracks me up. I'm going to have you go ahead and stand up for me. And I'm going to check your hips. So your hips are symmetric, scapula symmetric and aligned. No masses, no tenderness, correct? Spine is aligned. Go ahead and bend over like you're going to touch your toes. And back up. No signs of scoliosis. Go ahead and, I'm sorry, I got to stay close to you. Finger to nose. Finger to nose. Finger to nose. Finger to nose. Awesome. And walk heel to toe for a little bit. I'm going to try not to stand in front of it. And walk back normally to the bed. So coordination is intact, gait is smooth, posture is erect, fluid motions. We are going to test your range of motion now, okay? So I'm going to have you flex and look down at the floor. And extend your neck up and look at the ceiling. And then look back at me. Don't let me push. Don't let me push. Elevate your shoulders. Depress your shoulders. Elevate again. And don't let me press down. We're going to flex our arms. Extend our arms. Go ahead and squeeze both my hands. Grip strength is equal bilaterally. Go ahead and extend those arms again. Don't let me press. And don't let me press. We're going to stand on one leg like a bird. And externally rotate. And internally rotate. Don't let me move. Don't let me move. We're going to extend our leg. Flex our leg back. Extend it again. Don't let me press. Don't let me press. Go ahead and have a seat for me. So I'm going to have you dorsiflex your feet up against my hands and then plantar flex like you're pressing on the gas, okay? Up and down. Awesome. Intact bilaterally. I'm going to have you go ahead and lie down for me. We're going to do your abdominal assessment now. Okay, so my patient is in a supine position, knees slightly bent, arms to her side. I'm going to provide privacy in a warm environment by using the blanket. We're inspecting the abdomen first. It is flat and symmetric. No scars, no lesions, no masses, no ecchymosis, no peristalsis, no venous patterns, no striae noted. We will auscultate first so we don't create false bowel sounds with percussion and palpation. We're starting in the right lower quadrant where the ileocecal valve opening and closing occurs. So right lower, right upper, left lower in a clockwise rotation. Normal active vowel sounds are 5 to 30 a minute. Hypo is less than 5. Hyper is more than 30. We're going to percuss in the same order. Right lower, right upper, left lower. We should hear tympany throughout. Dullness over our fluid-filled organs such as our spleen and our liver. We're going to palpate in the same order, like palpation, moving from right lower to right upper, to left lower. We move to deep palpation if there was no pain. We're checking for masses, tenderness, guarding, distension. If a patient was having pain in a particular area, we would start palpation at the furthest quadrant away from that pain and move towards the pain. So, Miss Sammy, is there anything else I can do for you right now?
Nope.
Okay. Okay, well, I think our assessment is complete. I'm going to lower your bed and raise your rails up, put the locks on the wheels. I've got your call light here so you can reach it. I should be back in about 15 minutes. If you need anything before then, just go ahead and give me a shout. I'm going to clean all this equipment and doff my gloves and wash my hands and go document.
Okay, thank you.
Thank you.